and somebody who 10 months later is virtually incapacitated.
And I think it is. I think it is really clear between who has the baby blues and who has depression. But I think the major issue is that in America, we in psychiatry have not paid a lot of attention to the illnesses. We really haven't done a lot of research, except maybe within the last decade or so. So there hasn't been a lot of attention in America. In fact, in part of my preparation for setting up my program was to go to England and read a lot of the British literature about postpartum disorders. So we in America are just now beginning to get excited, interested in doing research. There's now more government funding for research projects. I think it's just a relatively new focal area of interest in America. So I think that we in mental health also need to take some responsibility for developing different kinds of educational programs for OBGYN, residents in training, all health professionals in training, because that piece is not out there now. So the lack of recognition, I don't think, is surprising.
Well, I mean, yeah, let me talk to, and I'll put this to our guests that we've spoken to earlier. I mean, do you all want to talk about doctors and how they reacted to? Yeah, hold on one second. Oh, let me go back here.
I think your obstetrician can make a big difference. There's a drastic difference between my first and second child. My first child, I had an obstetrician who told me to go out for a romantic dinner, didn't spend much time, would breeze in and out. My second obstetrician, a Dr. Zalowski in Uniontown, talked regularly with Dr. Wisner. He knew of the risk factor for me having my second child. And he did everything possible in working with her to do some preventative measures. And it was wonderful. You know, I called Lauren my second child my miracle baby. I actually, you know, I experienced euphoria. I experienced what I was sad about the loss with Katie, and it's filled that black hole, those memories of the depression up some. And I think as consumers, people should question their obstetrician to ask him if he'd be willing to, you know, talk with someone like Dr. Wisner if you're high risk. And so that's, you know, that makes your obstetrician, I think, makes a big difference. He's one of the first persons that may see some of the symptoms.
Well, I've been OB hunting for the past 4 years. I think I'm on my 5th one, and I really wanted to go to one that understood that this was an illness, and that I wasn't making it up, and really believed that this could happen again, because a lot of the obstetricians that I went to talk with and interview with, they were blowing me off again, like, this might not happen the second time, don't worry about it. And so I'm on my 5th one. I found one who really believes in postpartum, is going to try to treat me with Dr. Wisner. So they're going to, the two of them together are going to work together.
Could I ask you, though, I mean, just in case any of them are watching this morning, what would you like to say to them?
To
OBGYNs who might be watching.
Get educated. It just seems like that their responsibility stops when that baby comes out. It's like they hand you the baby and check on you a few times, you're okay, like, you're not my case anymore, give me your money, and we'll deliver the next baby. But their care doesn't go beyond, like, the delivery.
And then when it gets too complicated, you feel as if they're not there for you.
That's right.
All right, we're going to take a break. We're going to come back in just a moment. Here are 2 important numbers advertised earlier in this show. We told you we'd give them to you. The first one is for a support network of Pittsburgh. It's a postpartum support network. 412, if you're outside the greater Pittsburgh area, 571-3046. And then, following that, here's the number for Western Psychiatric Institute and Clinic, 412, if you're outside the greater Pittsburgh area, 624-1000, and that's to connect with Dr. Wisner's program. The support network, how does that function?
It's a group of women that have experienced a postpartum illness of depression or psychosis of some kind, and they work, the women that have spoken this morning, most of them are part of that network, and they have a monthly support group. They also, that phone number is a 24-hour hotline that you can call 24 hours a day, and someone will return your call and talk with you sometimes in the middle of the night. Husbands will talk to fathers of the babies. These women will also call and talk to other women that are in the hospital to help keep them in the hospital if that is the best treatment. They're wonderful, wonderful, strong women.
Okay.
And there's some of them.
Go ahead.
Yeah, we do have our meetings the second Tuesday of every month in Green Tree at St. Margaret's Church, and we encourage all women who have experienced a postpartum difficulty, whether it be a depression or psychosis or any kind of difficulty, to come. Bring their families, bring their mothers, bring anybody you want educated about the disorder, because a lot of people just do not understand. And we try to give our perspective as a patient's view of the illness, as far as recommending doctors. We talk about what medications we take and compare notes and symptoms and side effects. So it's really a different kind of view from a woman who's gone through it or women that have gone through it.
Donald, did you know there was even that kind of help available when you were going through this?
We went to the meetings. I'd got Marion to go a couple times. At some point she was, you know, she didn't believe that she had the same things as these other women had. She didn't want to go through the same treatments that they were doing. You know, it was the fact that she wasn't, a lot of her doctors didn't tell her that's what was wrong in the beginning. She wouldn't believe that was wrong, and you know, and she didn't get enough treatment early enough.
What would you like to say to the OBGYNs who may be watching?
Well, you know, they're merely human, but you know, they're doctors. They know a little bit more about certain things than other people do. Dr. Wisner knows more about something, you know, that the gynos know about. You know, it's unfortunate, you know, that there isn't one expert that, you know, every woman or every father or every husband can go to and ask them a question and get the correct answer, because unfortunately everybody doesn't have all the right answers. It's, you know, it's a matter of, you need more communication throughout the community and the city and the whole United States, just to get the point across, you know, that it's something, you know, it is an illness and it can be treated.
It can be treated. Let's talk about treatment. We've heard Prozac mentioned this morning, and we see headlines about Prozac being a very controversial drug, some people using it as a defense for violent behavior. Why is Prozac the answer in this condition, and what about that danger?
I'd like to just back up a bit to what I said before about this complex causality for depression. I mean, there's biological factors, psychological factors, and social or stress kinds of factors. And the treatment approach that we take really, although it's hard to understand what causes it, the treatment approach is a little easier because there are many causes, so that we can use biological treatments like medications such as Prozac. We can use psychological treatments like a special kind of therapy that Barbara is certified in, and also other kinds of stress reduction, anxiety reduction, just social support techniques. And we feel, you know, our collaboration with the PSN group is an important part of the treatment package. So we have a comprehensive approach. The women that we see are by and large very distressed. We don't see more mild forms of depression in our program because we're a specialty care center. So medication very frequently is used. Prozac is used in probably about half of our moms, often by their request. There is a lot of publicity, negative publicity about Prozac. I think any drug, what has to be remembered is any drug has side effects, and in our population of women, the side effects that we see from Prozac are generally somewhat less than the standard tricyclic drugs. One of those is that standard tricyclic drugs often can promote weight gain, and Prozac generally doesn't, and that's a big factor for our postpartum women.
What about electroshock therapy, which I also read about in the profile of treatment?
We certainly have had a handful of women who have not responded to, you know, our best efforts at psychotherapy, medication, the combinations that we use, who remain in the kinds of, you know, horrible distress states that you heard about today. And for those women, some of them have elected ECT and have had excellent response to ECT. We don't know why it works, but it's probably the best biological treatment that we have.
And go ahead.
I had ECT, and for me that's what worked. It was very fast. I wasn't really responding to medication, but it did work. It was like a miracle, I thought.
All right, we'll take a break. We're going to come right back in just a moment. Keely, you were right there on TV. Can we try this one more time? There's Keely, right there. Look, Keely, right there on TV. There you are. Not impressed. Okay. Can we talk about when somebody suffers from postpartum depression, how did they pull their lives back together again after treatment? And pregnancy is obviously possible again, and it seems as if things can work out if, in fact, treatment is successful.
The good news, I think, is that many of our women, once they've been treated and go through the therapy and the medication therapy, they actually come and say, things are much better than they ever were, because the actual process of recovery, they learn new skills that they may never have learned had they not experienced a depression.
Andrea from Shadyside, good morning to you.
Yes, I didn't experience my depression until about 3 months after my baby was born, and it lasted until pretty much she was able to do things for herself, like a year old. And when I went to my doctor, she said, postpartum doesn't last this long. So I just ended up thinking I was going crazy and had no support. My husband and family, they didn't really want to acknowledge this. I just became helpless. I couldn't make the slightest decision. And I was just wondering if postpartum does last that long.
Thanks so much for calling in.
Yeah. Actually, Dr. Wisner has a cartoon hanging over her desk that says, honey, our kids graduating from high school today, don't you think it's time for your postpartum depression to be over? But the point is, depressions can last any amount of time, not just postpartum depressions, but a depression, normally your body will heal itself and it'll cycle away. But it may be 5 months, it may be 5 years, it may be 20 years. And our message is, don't wait for it to cycle away if we can help it cycle away more quickly.
And one quick comment from a woman here, yes.
I was just going to say that as far as the medical profession is concerned, there are no conferences on postpartum depression. As a nurse midwife from McKeesport, I get a lot of information about conferences that are offered, and there just isn't anything about postpartum depression. There's not the opportunity for people to learn about it, unfortunately.
Makes no sense, does it? Back in just a moment to wrap. Very good girl this morning. Thank you very much indeed. And thank you to you, too, for sharing your professional expertise. I hope that if you know someone who has these kinds of symptoms, you'll reach out to them and help them reach out to find help. Thanks for joining us. We'll see you tomorrow at 10. Have a great day today.